The indications for performing an EJV are an adult patient in cardiac arrest where you have been unsuccessful at 2 peripheral cannulation attempts. In addition to this, we must make sure that the patient has had no trauma to the neck because we need to move the head around in order to perform the procedure. So the first thing I'm going to do is clean my hands and pop on some gloves. My patient will be in the supine position because this is a cardiac arrest patient, so CPR will be ongoing. And if I need some assistance in engorging the vein, I can consider raising the patient's legs up and popping them up on a chair. The patient's head needs to be turned to one side in order to expose the external jugular vein. And using my landmarks of the clavicle and the angle of the jaw, I'm going to follow the EJV down from the angle of the jaw in an oblique direction towards the mid-clavicular point. Whilst I'm identifying the EJV, I can ask a colleague or I can spend some time myself preparing a bag of sodium chloride with a giving set, being very careful to make sure that I've primed it correctly and that there is no air in the giving set. Being satisfied that I've located my site, I'll then clean it using a chlorhexidine. And pop this into the sharps bin. I'll ready my Tegaderm and my cannula, making sure with all the pieces of equipment that they are in date and they haven't been tampered with. When we perform the EJV, we need to use the largest cannula, so a 14 gauge cannula, because it's a very large vein and we want to make sure to reduce our risk of air embolism that we use the largest cannula possible. So I'm ready to do my venipuncture. My sharps are exposed. I'm going to stabilise my EJV and perform my venipuncture, hoping for a flashback and advancing the cannula. I then want to make sure that I'm connecting my cannula straight to the fluid, again to reduce the risk of air embolism. So I'm going to occlude the vein and stabilise my cannula. Put my sharp straight into the bin. And attach my fluid. Then secure that in place with the Tegaderm. And this is where if you do have a colleague, crewmate to help you, it can be useful. I'm only permitted to attempt this procedure just the once. And potential complications involve damage to surrounding structures. Once the needle is in place, I can then flush through and use my cannula as a drug port.